Battle, how do you pronounce your first name?
Like Charleata.
Charlita. Okay,
Yes.
thanks. Um, I'm going to say that we can skip most of these introductory slides with the people who are here. Nobody on this in this session right now needs to be reminded of all of this. Just for Charlita, here are the officers for the Consultants Network, and here
Okay,
are the officers for the Life Member Group. We're the two groups putting this on.
got it.
Um, and I guess I will remind everybody next month, the talk is going to be on the Panama Canal, observations from my consulting work. So a man who was actually there is still around, living with Carl in the Kai in the retirement center.
Wow.
Um, I think that's going to be a very interesting talk.
Mhm.
And then tonight, Charlita is here. Um, uh, Very impressive credentials. Assistant professor of management and healthcare. I have to move my window. Um, um, at CSU LA, Cal State University, Los Angeles. We have to get used to that. 26 years, diverse experience, healthcare industry, I learned tonight, higher education, IT, real estate, and starting businesses. And one of those in 2014, Char Battle Inc., delivering sustainable strategies for small healthcare businesses. Um, Teaching now at Cal State LA, um, academic senator, senator in the Senate, I guess, at Cal State in LA. um, Graduate Student Services Coordinator, and various recruitment and advisory committees, BA in Management, an MBA, and a Doctor of Business Administration, all from Georgia State University. So, and I do want to say for your benefit, Charlita, this meeting is being recorded. So, um, probably more people will actually see it than are here right now. It'll be on both of our websites, both of these groups' websites, and available. So I will stop sharing. I hope I can get yes, any kind of response. Okay, there we go. Thank you, Charlita.
Thank you. Are you ready for me to share?
Yes,
Okay, great. Mm, that- All right. Can everybody see the screen okay?
yes,
Okay, perfect. So good evening and thank you so much for having me. I appreciate the opportunity to come and what I call is kind of have a conversation with you all tonight about the role of artificial intelligence and how that artificial intelligence kind of falls into the healthcare landscape for today. So I'll kind of start. You can virtually raise your hand if you've ever been in a situation where you've waited at the airport all to find out that your flight was delayed or canceled. As you continued watching the monitors, you see that there is constant change in your new departure times and the updates on the delays. Well, imagine that for your travel experience and your expectations about where you hope to be in a few hours. Well, in the healthcare setting, this happens every day. We have patients who are waiting for beds, nurses who are navigating and juggling unpredictable patient admissions, and we have the regular routine of delays and backups created because of patient discharges are not taking place in a timely manner. What if you could make a difference by bringing in or introducing some type of artificial intelligence or AI tools into the healthcare organizations. Imagine if you could make this process a lot smoother, something similar as easy as checking into your favorite hotel or your favorite Airbnb. So, what I hope we'll walk through tonight is just a brief discussion about the landscape of healthcare, what the healthcare and hospital systems are dealing with, and why I think right now both healthcare systems and hospitals are dealing with a perfect storm as it relates to artificial intelligence. So, let's imagine we're in the hospital and it's Tuesday at 6 a.m. This particular Tuesday at 6 a.m., nurses are frantically running around facing the same uncertainty that they've dealt with for the past 4 or 5 years. Patient demand is always impossible to predict, and today is going to be another stressful day. Discharge delays are cascading like bottlenecks throughout the entire healthcare system, and staff is continued to forced to make critical decisions on yesterday's data. What if you could be instrumental in helping healthcare operations to be a lot more predictable? So, fast forward to the next Tuesday. This, if you would imagine, would be the Tuesday after you have helped implement an artificial intelligence product or service. It is now 6 a.m. again. But this time, this Tuesday, the healthcare system already knows one, which patients will likely be discharged today. Two, work capacity challenges will happen before lunch hour. And then three, because of your implementation, healthcare systems will now be able to optimize staff before rush hour of patient influx happens. So I'll start my presentation as we continue now to move from chaotic operations, how AI tools can transform healthcare or hospital chaos into coordinated care. So our abstract that was shared is imagine a healthcare system where patient flow is seamlessly as coordinated as hotel check-ins, where admissions for patients, discharges, and staff are proactively coordinated in real time using predictive data. In this vision, patients receive timely care. Staff are empowered to focus on what matters most, and the key operational decisions are made with confidence, not using yesterday's data, but using predictive data that helps them have more clarity and confidence in their decision making. But today's reality actually tells a very different story. Our hospital and healthcare systems, again, have unpredictable patient demand, and this is in the post COVID era. We're still dealing with constant delays that are related to discharges. We have overburdened, burnt out units that are just working under tremendous stress every day. We have workforce that really is stretched to its limits of capacity. Our nurse leaders are still making critical life decisions with very limited visibility while patient delays and staff continue to face ongoing burnout. This presentation will explore how healthcare systems can help bridge those gaps by leveraging AI-powered tools, things that are purpose-built, technologies that go beyond the limitations of our traditional EHRs. We'd like to, in our conversation tonight, learn about how predictive insights and those workflows of automation can help drive more proactive decision making, how that can help us optimize operational capacity and improve patient and staff experiences alike. We'll also examine some of the root drivers of these challenges, including aging populations, healthcare workforce shortages, and the all extensive financial pressures. We outline how AI can support transformational solutions in three critical areas that are important to healthcare and hospital systems. The first one being the patient experience. Second one is healthcare workforce well-being. And lastly, the business of medicine. which is why healthcare systems exist in the first place. Tonight, we'll join each other in discovering how forward-thinking health systems are turning complexity into coordination and how your organizations and with the right AI tools can do the same. So the current reality versus an ideal scenario. So in healthcare and hospital systems, we are still seeing patient demands varies and fluctuates unpredictably. Unlike hotels and hospitals, healthcare systems don't have the capacity necessarily to dictate when patients will arrive and their exact or precise departure time. Throughput issues and overlapping admissions continue to cause bottlenecks and delays throughout the healthcare systems. In different healthcare units, they're all reaching capacity, either at the same time or in a domino effect, starting with our emergency department and our PACU or a post anesthesia care unit boarding. Our nurse staff is continuing to experience burnout, and this is largely in part to resource strain. But what does all of this have to do with bottlenecks and the coordination of healthcare systems? All of this combines to have one big impact, and that is the gap between ideal operations and the reality creates systematic inefficiencies for hospital and healthcare systems. Aging populations, we're all living a little bit longer with more complex health issues than we have ever done previously. This requires intensive care coordination, unlike we have ever seen before. We also have financial pressures. This includes dealing with and navigating Medicaid cuts, transitioning over to value-based care changes, and then challenging payer mix dynamics. And thirdly, we have workforce crisis, as I mentioned earlier, still dealing with some sense of burnout. We have shortages that are affecting our healthcare and our hospital operation capacity. These three things have a major impact. They impact and create organizational gridlocks, and they reduce operational capacity across the entire healthcare systems. Some of the key drivers for these issues. We have three that we'll kind of talk about tonight. So one is the patient experience. The patient experience includes healthcare access optimization. That means, can I get to healthcare access quicker, sooner, and can I have my healthcare in an improved state? Two, we're looking at the quality of that healthcare improvement. When I come in as a patient, what am I experiencing? What is the quality of care that's actually being delivered to me? And then thirdly, what is the cost reduction strategies for me as a patient when I come into a healthcare or hospital system? Second, we're dealing with healthcare workforce issues. We still have the ongoing stressors and drivers of skill workforce shortage, burnout prevention and wellness, and the ongoing issues related to staff morale, motivation, retention, and recruitment. Third, we'll deal with the business of medicine. This is more towards the hospital and healthcare systems operations. The healthcare system is more concerned or has to be concerned with optimizing their revenue. They also need to be concerned with managing and navigating their cost in an ongoing changing healthcare landscape. This means that the hospital may need to take a little bit more care and pay attention to its operational costs and navigate or maybe delay some of the capital improvements that it has planned. So let's look at how AI applications and predictive analysis can make a difference on each of these four areas. I'll go over all four and then we'll break them out individually. So the first area is patient flow prediction. Machine learning is fantastic for this. It has the ability to have algorithms that can analyze historical patterns and predict admission volumes, discharge timing, and capacity needs, up to 7 days in advance. Remember the Tuesday scenario we started out our presentation with tonight. 7 days in advance is huge. Secondly, we have the length of stay optimization. Because we have those ongoing bottlenecks of discharge, AI models and tools can help healthcare systems and hospitals better predict patient length of stay regarding their diagnosis, comorbidities, and treatment protocols to optimize bed allocation. Third, we have readmission risk assessment. Natural language processing is fantastic for this solution. Natural language processing, or NLP, can help analyze clinical notes to identify patients at high risk for admissions and enabling proactive interventions. NLP can also be used and is being used for some ambient note taking into the EHR directly. And then fourth, we'll talk about resource demand forecasting. So looking back at patient flow predictions, how AI strategic value for hospitals. This requires, well, hospitals are required to report to CMS, the Center for Medicaid and Medicare, reporting on patient throughput as well as their emergency department metrics. This is critical for Joint Commission accreditation, compliance, standards that need to be met in terms of patient flow and safety, which every hospital has to make reports on. Optimizing AI strategic value for hospitals as it relates to patient flow prediction is also critical for hospitals in terms of value-based care contracts that penalize capacity-related delays. Length of stay optimization. AI strategic value for hospitals in this space directly impacts the hospital's reporting to CMS, their reimbursement rates, and DRG payments. And DRG payments are diagnostic related group payments. In other words, they're codes that are related to diagnostics for diseases, and it helps classify inpatient and the reason why an individual is receiving care at a hospital or healthcare facility. Key metrics for hospital include their ratings and public reporting. Additional major factors that come into play here are payer contract negotiations as well as bundle payment, all of which AI strategic resources could help move the needle in a more positive way for hospitals regarding length of stay. Third,
Hi, oh, sorry. Charleata, can you answer a question?
yes,
Oh, on your previous one on those DRG payments,
yes.
um, do they include like all this lab work and tests that, doctors like to do?
Yes. So first, the DRG codes, there are literally thousands of DRG codes. So for example, there is a DRG code that may be code 172. DRG code 172 says a patient has come in for a parasitic infection. And then you have all of the laboratory, all of the other codes associated with the treatment that are related or fall below someone coming in presenting for parasitic infections. So great question.
Thank you.
Mhm. All right, so readmission risk assessment. AI's strategic value for hospitals in this space is also extremely critical. We still have CMS reporting, which all hospitals have to make those reports. Here we're looking at hospital readmission rates program. Hospitals' readmission rates, if they are negative, hospitals can and will be financially penalized with high rates where patients are readmitted within or under 30 days. 30 days is that magic number. If an individual is discharged and it's closed out with that DRG code that they have received full treatment and are able to be discharged home, yet the individual comes back as a readmission, hospitals receive financial penalties as a result on that care treatment specific to that patient. So core quality measures for hospital star ratings, again, we're dealing with public scorecards as well as other internal scorecards and metrics regarding our readmission rates. And lastly, here, we're looking at required reporting for conditions such as heart failure, pneumonia, hip, knee replacements, and other issues that people come to the hospital for. All right, our fourth one and last one is the resource demand forecasting. This is AI strategic value for healthcare systems in this space. A few slides earlier, I mentioned the Joint Commission accreditation. This also is essential for meeting staff requirements and patient safety standards. Also important in this area is critical for budget planning and labor costs. We're still managing personnel as it relates here, which could be up to 60% of a hospital's expenses. That's a large amount. Lastly, on here, resource demand forecasting is required for emergency preparedness and surge capacity planning per the CMS conditions for participation as a hospital and healthcare system. So what do these have in common? They culminate as well to have an impact in all these areas which directly impact a hospital's financial performance. It impacts the hospital's regulatory compliance. And lastly, the quality ratings that affect both their reimbursement and their public reputation. AI applications and real-time optimization. Some solutions that AI-powered tools can do. Purposely built AI tools for healthcare systems can provide cutting-edge solutions that provide insights that allow us to move away from looking at yesterday's data and start looking and working from predictive insights. This helps to have workflow automation, enabling hospitals and healthcare systems to be very proactive in coordinating care across the continuum. It is also real-time data access for all staff who collectively work together to coordinate care much more effectively. This can also inform strategic decision-making tools to help anticipate and prevent barriers, including those bottlenecks that we talked about a moment ago. AI-powered tools also can offer 30% reduction, for example, in patient boarding. And as a result, that can also reduce and improve inpatient discharge timing. And lastly, if, for example, we incorporated such a tool, our outcome is that we have 20% increase in staff efficiency. Therefore, we have a 15% reduction in the patient's length of stay. That's helping us with that discharge bottleneck that we mentioned earlier. AI-powered transformation, some potential solutions, and again, some more sample outcome metrics. So potential solutions could be purpose-built, again, AI-powered tools, providing predictive insights for healthcare staff. Workflow automation. This is a huge and just an essential piece and component of healthcare operations that always is in need of some type of AI-powered tool to help them be proactive in coordinating care. We also have real-time access for data for all staff, which I just mentioned earlier. And lastly, strategic decision-making tools. So we have decision support tools that continue to help prevent bottlenecks and barriers. Some sample outcomes could be a 10% or another number reduction in length of stay, 20% reduction in patient boarding, that is admissions, 25% reduction in patient discharge times, 25% increase in staff efficiency. So all of these outcome metrics are things that hospitals would find favorable. Each of these areas are areas of problems that are routine on a daily basis for healthcare systems. So any AI tool that would offer improvements in length of stay, patient admission, discharge time, and staff efficiency would surely be welcomed. And what you can do in consulting, in conversation about what healthcare needs are, you can offer and guide healthcare systems in the selection and implementation of new AI tools designed for patient flow, optimization, workflow management, operational efficiency. These three system integration integrate AI platforms seamlessly in their existing EHRs. Two of the leading EHRs, if I may, I will say, Cerner and Epic, they seamlessly integrate with these tools, creating a unified data ecosystem and enhanced decision making for our staff at the hospital. This also helps improve change management and help the organization get through change management much quicker. This can lead organizations through transformational initiatives to ensure a successful adoption of the AI-powered tools that lead to improved workflows and processes. And then lastly, performance analytics. This helps us develop custom dashboards and analytics solutions in which we can measure the impact of AI on patient outcomes and other operational metrics that the hospital may find that they would want to pay attention to. Our key takeaways from our conversation tonight is the future of healthcare using AI-powered tools. 4 key takeaways are: AI transforms reactive healthcare operations into proactive and predictive systems. Multiple AI applications can help address patient experience, workforce, and business challenges. Third, technology consultants have a significant opportunity in healthcare with AI implementation tools. And fourth, success requires purpose-built solutions, not just EHR modifications. And lastly, the impact of these 4 items. I would say, in my opinion, the time for AI-powered healthcare optimization is now. Healthcare systems are at the perfect storm to receive, to evaluate, and to implement new AI-powered tools. And I thank you. I am available for questions and any other conversations that we might like to have.
I have a question.
Mhm.
This seems like it's a no-brainer in the sense that I'm surprised that there aren't 10 bazillion companies out there pushing AI, especially for things like the prediction and taking care of a lot of the paperwork stuff. So what do you think is the key roadblock that's stopping that from happening?
You ask a fantastic question. So I think I will start with the fact that healthcare is notoriously one of the last adopters of change. Change for healthcare is difficult. And using buzzwords, catchwords such as AI, artificial intelligence, usually makes people have a closed mind before they have an opportunity to understand what the benefit of AI could be. So one, the healthcare sector as an industry is slow to adopt. And then two, I think the other reason why we're not seeing a rapid implementation of tools is that AI tools themselves are changing at such a rapid pace. By the time you can develop a software tool, and now you're able to go implement that, that tool itself may now be obsolete or have another version that is an improvement upon itself. So grabbing a hold of a system that is something that may still be open to having some modifications, even knowing that you can take that to a hospital now, they can benefit from it. There's just a delay in hospitals saying we're ready to take a risk with this new AI tool, and we don't know 2 weeks, 3 weeks, a month from now, what is the status of that tool? So there's just some hesitancy from the healthcare industry as a whole, being a very late adopter. But there is such an opportunity. I think maybe another issue of why we're seeing some delay and pause of healthcare systems welcoming and ushering in AI tools is the ethics about AI use. There's still not quite a definition about where that space is. So there is still some hesitancy on rapidly deploying AI tools in healthcare apart from decision making tools. Did I answer that question for you?
Yeah, thank you.
You're welcome.
Yeah.
Hi,
Hi.
Dr. Charleata. I have a question.
Yes.
Oh, on
Uh,
your previous slide,
I'm sorry. I should have asked you to stop sharing slide.
it's okay.
Okay, I'll go back.
You have a bullet about the uh,
Go back one more.
no, this one, yes. On the third item, about technology consultants, opportunities. Can you maybe delve a little bit deeper into that? Like, I mean, there are many areas, obviously. Would this be, for example, like, data, healthcare databases, maybe large language models, machine learning, and things like that? I don't know how technical. You don't have to go too technical, but maybe just go a little more into this if you don't mind.
Wonderful. You asked a question that speaks to my heart. So thank you for asking that. So, where is the opportunity? Where should you focus? What is the need? So, I will just share many years ago, I started out consulting and I literally had a checklist that was carbon, maybe 5 sets of carbon, so I could assess or basically perform a business analysis to identify this healthcare system's issue. Where was the pain point for this healthcare organization? And then I went back to my office to figure out, well, what kind of tool do I have that can fix that pain point? So this bullet number 3 is saying, hey, healthcare systems have a lot of pain points, which translates into a lot of opportunities for consultants. So if you would, as a consultant, wish to concentrate in a couple of areas, one, I would recommend anything in healthcare operations. And healthcare operations could be group per hospital role. Healthcare operations include healthcare administrators who are doing the management and billing collection. In the operations, you have revenue cycle. These are the individuals who are managing, collecting the revenues. So if you have a AI-powered tool that helps the revenue cycle department be more predictive on the finances that they're going to collect, that is extremely important. If you can incorporate a tool that helps the operations determine on Tuesdays, that's when we have most patients that come in the emergency department after 3 o'clock. If you have any type of predictive tool that could help operations with workflow management, that would help us as a healthcare organization determine how many patients we're now going to expect. Because I can predict how many patients that are going to come in Tuesday after 3, I can now better organize my nursing staff. Because we've been able to predict that we're going to have an influx of patients after 3 o'clock, I can now manage my human capital and my nurse workflow. I can better staff people so we're not dealing with burnout. So if you just focus on operations, that's just one piece. Operations, finance are just two of the key areas that are ripe for AI tools. That's just on operation side. If you're dealing with the patient and healthcare provider experience, this is different. This is where the healthcare provider, the physician, can benefit from tools like that ambient listening to help take those notes into the EHR while that provider is only there for 15 minutes tops with the patient. They can start have charting because of that ambient tool that helps them more accurately report and chart what happened in that patient experience. What did the patient say they were dealing with? What was my report out and the next steps for a follow-up appointment? So there are patient-facing improvements and workflows that AI tools can assist with. And then there are operations, management of revenue, and reporting that tools also can benefit from. Hospitals have, again, delayed many um, advances. So there are a lot of opportunities for consultants in terms of healthcare. I would say focus on one specific area versus trying to do operations, finance, and technology. Healthcare systems are also notorious for legacy systems. I recall back in many years ago, we were transferring, we're basically doing a digitizing project. And that meant we had to take all of our TDK tapes and now convert them to a digital platform. And then I also had to find a provider who would shred those TDK tapes. I mean, there are hospitals who are using legacy systems such as that. They need to bring things out of a physical paper environment into a digital environment. That is always going to be the case. Someone is always moving from a legacy technology system into a new system.
Yeah, hi Chad. Sorry for late. I went out for a walk with kids
Do
and
I still need to
yeah.
share? Oh,
Okay, so
okay.
that's okay. So I had a general question regarding this presentation, even though I joined a little late, but I got the content and all that, right? So, are there any separate LLMs built for just for the healthcare? Because SAP, like a company, it
Mhm.
is building its own ERP, like a database, right? For all the customers' data and all that. So, healthcare itself is a big wing, like a defense or any other wing, right? So, are they building any such things or?
No, unfortunately, with healthcare, I think the best way I could describe it, healthcare is international, it's worldwide, but it's delivered locally.
Okay.
So, because of that, there are always problems of interoperability.
Hmm.
There are always problems of budgetary constraints. So there's never one size that will fit all. There's never one tool that could be customized to fit all because the population dynamics dictate we give care and deliver care differently. And
Okay.
because of that, we start with the shell of Epic, but it becomes so customized to that healthcare organization. You can't take that shell, that Epic instance and take it to another hospital and it work well. It's going to have to be recustomized. And I've tried to stay away from the word customize because that also seems scary to some healthcare organizations. When you say the word customize, they translate that into its cost.
Yeah, high cost.
Okay.
Yes. I know because I was consulting and I've done consulting. So I learned how to rephrase the value that technology could offer without saying customization. And how I say now is that it's built purposefully and that is local.
Correct. Okay, but that's more on the administrative side, right? But if
Definitely.
we consider the other side of it, like a research side, for example, if somebody is doing research on the cancer or some other specific area, right? If they need a database specific to only like we have a medical journals, we have medical databases, so many, right?
Yeah.
So like that, if we have a separate LLM for just the medical field, healthcare field,
I
where
think
in
that's
all
a
the
good use case. I think that would be an excellent use case because research is evidence-based and it's pretty much going to be predictable. I think that's an excellent use case. Thank you for circling back with that. Yeah.
yeah, thank you.
Yeah.
Yeah, my personal, I think there's a lot of different system within the medical. Uh, your hospital, big hospital, small hospital, county size or big city, and also a private practice. And some
Yes.
more old fashions or the younger people, they give you a report right away within 24 hours for the new
Right.
clinic. But all one, they don't tell you anything. The doctor.
Right. Right. I mean,
So,
there are so many nuances
right,
of
yeah.
healthcare systems. So again, there are just so many opportunities. I think if you focus on functional areas,
Mhm.
that would be perhaps your greatest value. If you can help an organization solve something specifically in a functional area, you can be their go-to for all the problems that are
Mhm.
in those functional
Yeah.
areas.
So I can see that the hospital, they have a lot of point solution. They have a newer workstation that can help the doctor and nurse. Also, they have some kind of new equipment like portable X-ray, portable EKG, and some other equipment that they're using. I think MRI, there's a new one coming up that can portable. So you don't have
Mhm.
to go to big machine. You just want to scan one small part of your body. So I think
Right.
technologies, point solution, also surgical. There are Da Vinci tools can help to do a remote surgery. So those are
Mhm.
point solutions. Some are available, some are acceptable, but to tackle the whole system is kind of difficult, I think.
It
Right?
really is. And I agree with you in that sense. Healthcare systems need, again, they're just resistant to change, just the
Yes.
healthcare industry as it is. But if you just help them tackle one small piece and part, it
Hmm.
helps them, if they can improve one area, they can see the possibility of continuing to take this step forward in an uncertain space for them.
Yes.
Bob, you had a question? Okay.
Okay. Yeah, I think that in
So,
some area, like the surgery area, probably can be more organized. You need to have these, the number of doctors available, the room available, facility available, then you can schedule in. But the emergency center, maybe you don't know how many people will show up that day. But also
Yes,
can do some statistic, right? You can say average,
yes.
how many.
I
So,
think it's really good that you mentioned about the operating room. So one
yeah.
of the problems that we consistently had, I used to work in the labor and delivery OR side.
Uh-huh.
So one of the problems that we consistently had is if the first OR case did not start on time.
Hmm.
So we didn't have any type of predictive tools to say that OR cases not starting on time, you can do this. We started the day with a bottleneck because we were not able to predict when OR cases did not start on time. We had no backup of what do we do next.
Hmm.
Then we had OR cases that would go over what we estimated for time. So therefore, if we had 10 OR cases scheduled for today, the first one didn't get started on time. We had case maybe number three, the person did not receive authorization for surgery, and now their surgery is canceled
Whoa.
simply because the pre-authorization was not approved. So AI tools can assist with those payers and providers who require pre-authorization. We shouldn't have an OR case that doesn't proceed because of a failed pre-authorization. But pre-authorization is in the house of operations,
Hmm.
but it impacts directly the care delivery because now we've lost the case for the day. So we started out with an OR case that did not get started on time. It's run over late. Case three is not happening. And therefore, we're going to end the day 6, 7 hours later for the last OR case. So now we're dealing with nurse burnout, provider burnout, we're dealing with patient bottlenecks, we're dealing with everything that I mentioned on the slide that's unpleasant. And then we're asking people to come back to work tomorrow and do the same thing again.
Mm.
And the next day, all the way through next Tuesday.
Yeah,
Do
probably
you have
everyone have
any?
some issues they can tell, like how long you wait in the waiting room before you see the doctor. Sometimes wait a long time, they've been very on time, but suddenly wait for 1 hour, more than 1 hour.
Now,
Yeah.
patient wait times is also another opportunity, but I was working with a client to implement a patient wait time improvement initiative. The issue came up in terms of privacy. It was wonderful that the tool could predict, it could navigate patients through, but we ran into a problem at the healthcare center because we needed to display a patient last name
Mm.
or an ID number so the patient would know, okay, I'm next in queue. So when we have a volume of patients sitting in a healthcare setting, is it or is it not ethical to have a patient's name up on a board so they can see that they're in queue?
Yeah.
Do you see
Yeah.
how that solution just kind of went nowhere?
Yeah. Well, in operation room, they have a shortened form to list your first and last name plus a number or something. And that, I think that kind of coding is helpful so we can see in
Right.
operating room. But in the general practice, sometimes they really don't give you anything. So you just
Right.
wait
Just
and wait.
right. For the client that I was trying to do that solution for, we could not get around publicly sharing
Mhm.
some type of identifiable information so people sitting in the waiting room would know where they are with patient wait time or moving to the next when they
Mhm.
would be seen. It just we could not get a solution to work around that.
Yeah. But I think some of the system that had improved is the visit paperwork. They ask you to fill in the
Mhm.
form like 1 day before, a couple of days before. So
Oh
they
yes.
get that part already done in some facility, but not everybody. So maybe something
Yes.
will standardize or
I agree with you. That ability to electronically check in,
yeah.
provide insurance information, and sign in for your appointment, as well as pay your copay, kind
Mhm.
of started during COVID. And some healthcare organizations have optimized and continued that practice today.
Oh, okay.
Others said, okay, if we don't have the federal financing for that particular tool, and we don't have the government subsidies, we're no longer going to use it. So that is still an opportunity to help healthcare systems with their paperwork process of checking in for an appointment and providing insurance. All of the pre-appointment paperwork can be done seamlessly online. They can check in from the car with an app and get reminders.
Right.
So, Chad, do you have any papers, upcoming papers that you are going to write or publish or anything you would like to share with us?
Yes, I am working on a case
Mhm.
with a healthcare organization that is currently implementing an AI tool to optimize their surgical scheduling and their surgeries.
So it's a case
So
study.
it is a case study of one
Okay,
hospital. Mhm.
nice.
Yeah.
Very interesting so far.
That's good.
Yeah, actually, can you send a copy of your presentation to us? So can
I have it,
you have
Yes.
Kyle.
it?
I'll
Okay.
share with
Yeah.
you. Yeah.
Okay, sure. So right now it's a 7:20 or 30. So any question from the audience? I know Ken's still struggling with the audio. Ken Birch. Any question? If not, then let's find
And
Dr.
if
Battle for
anyone,
great.
if they have trouble with the audio, they can always type into the chat box.
Oh,
Yes.
okay. I'm not sure. I mean, from maybe as his phone has some problem, he can still struggling. Ken Birch. Okay. So if there's no more question, let's thank Dr. Battle for such a great presentation. Long alert a lot about the healthcare system need to be fixed.
It
General,
does.
especially those who have gone through that in the last few months or last few years.
Mhm.
So a lot of work needed. So your work was very good, very welcome. Yeah.
Thank you for having me.
Yes.
Thank you for your time, Chad.
Thank you for your
Thank you
time.
for
So
accepting
much.
the present.
Thank
Thank
you.
you.
Thank you.
So next month
Bye,
we'll
everyone.
meet on the 9, October 9 in Westminster facilities, do a hybrid meeting. So we'll move up 1 week to coincide with the engine week. Okay. So see you guys.
See you.
Thank you.
Yeah. Thank
Bye.
you.
Bye.
Thank you.
Bye.
Bye.
Have a good evening. Okay.
Bye.
Bye-bye.